Begin by bringing your right knee as far to your chest as you can and holding it for 30 seconds. After 30 seconds, gently press your knee into your hand for 5 seconds, relax for 5 seconds, and then repeat that 3 times. And then with your left leg, push your heel into the floor for 5 seconds, rest for 5 seconds, repeat 3 times. Then bring your left knee to your chest and repeat the cycle. There are several ways to do this stretch. I'm going to show you 3 different methods. The first method would be pulling your bent right knee with your left hand. Slightly more advanced is taking the left leg and bending it over the right knee and twisting to the left, letting your arms relax to the side as shown. Next would be bringing the right foot across the body and reaching the foot as far as possible. Now I'm going to demonstrate it again, but on the opposite direction. For this stretch, you can place the foot of the bent leg on either side of the knee. For all 3 of these stretches, you can hold them for 30 seconds to up to 2 minutes, or 5 to 10 breaths. Next, we proceed to do lumbar flattening, as described in my lumbar flattening instructional video. Now proceed to do a thoracic mobility exercise. But if you don't have that time, consider doing it for at least 1 minute. We now proceed to doing thoracic mobility in the prone position. Next, we proceed to doing the prone thoracic mobility exercise, commonly known as the child's pose. Trying to get your heels to get close to your buttocks. Or 3 deep, long breaths. Next, we proceed to do some core strengthening through some pelvic bridges, as described in my Core 4 fitness video. Just do the best you can. If all you can do is pelvic tilts with your hands on the floor, then try 10 of them. Next, we proceed to do a fairly complicated stretch that works on the posterior chain of the spine. Now lift the foot that corresponds to the hand that's above your head and try to lift the foot up and over the other foot. Maybe all you can do is lift up the right foot and just barely get it over the left foot. You'll be able to rotate more and finally get the foot to the opposite side of your body. This stretch also works the deep spinal muscles, which are critical for core stability and overall spinal health. The next exercise is called prone extension, also known as the cobra, which means that the front of your hips are as close to the ground as possible as your spine leans backwards. Here I'm adding some simple rotation to the left and to the right. Try to do the prone extension for about 2 minutes. Raise up on your hands and toes. Push your heels towards the floor, but they should not be touching the floor. Now add a gentle bounce, pushing your heels towards the floor. Now we transition from the A-frame to the C shape and back. A-frame, C shape. The posterior chain is a collection of interconnected muscles and the overlying tissue called fascia that connect the feet to the head. They can start from the plantar fascia, the bottom of the feet, go up through the calf muscles, hamstrings, into the gluteus maximus, up the spinal muscles, into the back of the head. Two other muscles, the diaphragm and the latissimus dorsi, also play a critical role in influencing the function of the posterior chain, which helps with all spinal movements. This set of sequences helps encourage posterior chain mobility throughout the entire spine. We start off with a tennis ball or any other ball that has some type of compressibility but has firmness. And you spend a minute massaging the foot back and forth. After that minute, you drop the heel, stretch the calf, take one hand and stretch the upper part of the neck. Just pull the head forward to the point of mild discomfort and a slight stretch, and hold that for another minute, and then we repeat to the other side. Here I demonstrate it from a different angle. I do recommend 1 minute on each foot and 1 minute for each stretch, for a total of at least 4 minutes. Next we move on to the latissimus dorsi muscle. This attaches to the upper arm and extends all the way down to the low back. You're going to place your palms and the forearms on a counter or a table, then slowly walk backwards till you get to the point where your back is pretty flat. Then you start bending your knees up and down. It is important to try to get your feet as far back as possible, but keep half your forearm and your palms on the table. I'll demonstrate it one more time. Remember, you want to keep your palms and at least half your forearm on the table and step back as far as you can and try to get your back as flat as possible. I like bending the knees as it's like flossing the tissues, allowing it to stretch and relax, stretch, relax. But you can also find benefit holding it for about a minute or two. Next we proceed to the diaphragm stretch. While you're sitting comfortably in a chair, take your fingers and gently curl them underneath your ribs. I recommend 10 breaths into the fingers at least. Finally, we do thoracic mobility, leaning backwards against the back of the chair. If you can't get your hands over your head, use your hands against your lap and gently push backwards. And here I demonstrate it from a different angle. 10 breaths into the diaphragms, and then for the leaning backwards over the chair, 10 back and forths, and then hold that backward stretch for a minute. Squats. This video will demonstrate how to do various number of squats, starting from the simplest and progressing to more challenging. Determine which squat you need to improve and practice it throughout the day. Now, balance. Balance in many ways is the ability not to fall over. The number one way to prevent you from losing your balance is to improve your squat. The simplest of the squats are the chair squats. The two variations will be shown here. First, sit on the edge of the chair. Put your heels slightly behind your knees. Put your hands together between your knees. Bend forward and push yourself up. Then lower yourself down by reverse sequence. Again, bend forward, stand up. Then sit back down. The second variation is putting your hands out in front of you and standing back up. Again, using the edge of the seat and your heels slightly behind your knees will be very helpful to accomplish this squat. The next squat is called the single leg rear foot elevated squat, also known as the Bulgarian squat. Here I'm using a cushion on top of this hard chair, but if you have a soft chair or an exercise bench, you can use that as well. You can do it also on a couch. I'm rolling my pant leg up so you can see where my foot is placed. And I want to make sure that my rear knee is behind my front knee. Here I just readjusted to make myself a little more comfortable, and I want to make sure that my rear ankle is just on the edge of the chair. That'll give me the most mobility. And there I am switching sides. You can see how my front foot is trying to stay stationary. Keep the heeling on the ground. Next, I'm going to show you the same squat, but without the assistance of the table. I'm going to place my hands on my waist, and this is going to increase the challenge of my balance. I do the exact same exercise. I want to make sure that the ankle is on the edge of the chair, which will increase my mobility of my hips and my knees. Next, we proceed to the deep knee squat. Do not try this squat if you have a hip or knee replacement or have concerns about the health of your knee. Begin by putting a little bit of an arch in your back. Here I place my hand at the base of my back just to help me know that I'm putting an arch there. It also means I'm doing an anterior pelvic tilt and push my hips downward. Next, I position my feet comfortably, just a little bit wider than my shoulders. I then put a little bit of arch in my back, hands out for balance, and squat down as low as I can. In the ideal squat, my back is much straighter. However, I have a kyphosis, or a little arch in my upper back, which prevents me from having a completely straight back. There I resetted my hips, put a little arch in my low back, and then proceeded to do the squats. Ideally, with each squat, your heels do not leave the floor. Here I demonstrate the squatting without arching my back. It's just a little bit less efficient. Here I put the arch in my back again, and then squat. So here's a squatting from the front view. We do not want the knees to go towards each other. Here I'm demonstrating the knees moving towards each other. And if you want to try it, just so you know what not to do, alternatively, you want to have your knees pushed outwards, like I demonstrated. Don't push your knees so far out that your feet leave the floor, but just push them out just a little bit, and then as you squat, your knees should glide over your toes. For bodyweight squats, it's okay if your knees go over your toes. Finally, can you do the duck walk? And how many steps can you do with the duck walk? Arch your back, squat down. How far can you walk? For the duck walk, it's okay for your heels to leave the floor. Now with your feet separated so there's a little tension in the band, do a little squat and push your knees outward. Just bend your knees outward as shown. To be a bit more challenging, see the squat in the upper right hand corner. This does help teach how to do a good squat. Now we start doing side steps. Keeping tension on the band, we sidestep to the left, then we sidestep to the right. Keep going back and forth for at least 30 seconds. This section will show you the same set of squats, but from the front view. The final squat is the door frame squat. Just take your ordinary door, position yourself somewhere in the middle, and squat down as far as you can. Take full advantage of the door frame to help you down and help you up. This is an excellent way of strengthening the core muscles of the lumbopelvic region, the hips, the knees, and the ankles. This video was designed to show how easy it is to incorporate squats into your everyday activities. Squatting is as important to movement as breathing is to life. Consider doing 5 squats every hour you're awake. After 12 hours, that's 60 squats. After a week, 420 squats. After a month, 1,800 squats. And if you can incorporate the 10,000 steps a day, now you have a nice fitness routine that you can do every day to improve your overall health. While you are becoming familiar with this sequence, pause the video to practice each activity. Eventually, you will not need this video in order to do this sequence. The approach to these mobility sequences is to demonstrate activities that can be done throughout the day. The more you can find ways to incorporate this sequence into your daily life, the more benefit you will find. Fitness is a daily lifestyle that can be improved with small steps throughout the day.